All right. Hi, everyone. My name is April Bean, and I am the Senior Director of Marketing here at Quest Analytics. And I am so excited to welcome you to our webinar today called No Surprises Act, What You Need to Know and Why. And I have to say, if we were in person today, I would say we'd be in a session with standing room only. So I'm really excited to have all of you here with us today. I'm really excited to welcome these two individuals to our webinar today. Up first is John Weiss. If you don't know John already, he is the president and co-founder of Quest Analytics. And he really is a visionary around solutions that he's brought to the healthcare market for the past decades. He's pioneered industry's first accessibility tools and developed partnerships with federal, state, and commercial markets. He really has evolved the idea of simple access standards to automated network adequacy and accuracy solutions. So we're really excited to have him joining us here today. In addition to John, we have Mike Adelberg, who is the leader of Fay Gray Drinker Consulting's healthcare strategy practice. And so he's going to bring a lot of unique insights into the processes, policies, and the people driving the major government healthcare programs. Now, the other reason that we brought Mike on board here today is because he brings a very unique perspective. He's held several senior positions within CMS. So he's really bringing that regulatory perspective that we really want to dive into during our session today. Speaking of which, here's what we're going to be covering today. So to take us off right at the beginning is going to be Mike, and he's going to give us kind of a deep dive into the No Surprises Act. Now, if you haven't heard of the No Surprises Act, or it was kind of a surprise to you, that's not a surprise, because it was buried in a 5,000-page omnibus bill that was passed way back in December. So what we're going to do today, though, is we're going to dive into one section of the No Surprises Act, and that's the one that talks about provider directories, specifically around your commercial networks. That's why you're here, right? Then we're going to move over to John, and he's going to start talking about what kind of implications those have on the adequacy of your commercial networks, and then also help you garner some best practices and strategies for achieving that compliance. And he's also going to walk through what you should be doing right now. And I'm sure that's why all of you are here and you just really want to get started. So without further ado, don't forget we'll have Q&A at the end. If something pops in your head, throw it in the chat. We're going to take those as they come. And then we'll also open the mics at the end of the session. So without further ado, Mike, I'm going to pass it over to you.
Hey, thanks, April. It's a real pleasure getting a chance to speak with the Quest team and, of course, the hundreds of participants in today's webinar. This is a great topic, and you teed it up wonderfully. The No Surprises Act, in fact, has some surprises in it. The primary public policy problem that was addressed by the law, the one that generated all the media attention, is the problem that health plan members in commercial market plans are going to in-network facilities. At those in-network facilities, they are receiving some care from out-of-network docs. And because the docs are out of network, consumers are getting hit with large bills. That is a public policy problem. The consumer is essentially doing exactly what she or he is supposed to do. They're going to an in-network facility. They can't know that the radiologist or one of the other specialists is out of network. They have no way of knowing. And so a number of states have stepped in. They've passed various consumer protection laws, but a lot of states haven't. And those consumer protection laws that have been passed are all over the map and being enforced in very different ways. So what the No Surprises Act does is it takes on this problem by creating a federal floor. It's not our job to talk about surprise billing, but since it's the headliner in the No Surprises Act, let's just discuss it very, very quickly. The primary consumer protection is that the consumer who goes to an in-network facility is held harmless. That consumer can consent to getting care from an out-of-network doc. There are then requirements on that facility with respect to providing a good faith estimate of service and giving appropriate notice to the consumer to make that decision. Under the law, also, if there are, let's say, multiple radiologists or multiple anesthesiologists, and some are in network, some are out of network, the facility has to inform the member which providers are in network, give the consumer the opportunity to see the in-network provider. This protection applies to most forms of care, but there are a couple of carve-outs in the law. In the event that there is a billing dispute between the facility, the out-of-network provider, and the health plan, there's baseball-style arbitration set up. It's called baseball style because the arbitrator hears the two claims from the payer, from the provider, and then selects the more appropriate rate, no splitting the difference. The arbitrators are also forbidden from using public programs as a benchmark for determining the appropriate rate. None of this consumer protection or process set up preempts state law. If there is a state that has gone ahead and ahead of the feds and created more complete consumer protections, then the state law remains in force. And in terms of the enforcing regulatory entity for fully insured plans, that is, of course, the state. For self-insured plans, that's the Department of Labor. And importantly, we'll see some very important federal regulations defining all of this. It'll probably come up in John's presentation. It'll probably come up during the Q&A, that there are some important details that remain unanswered by the legislation. So sometime this summer, we're going to see some pretty important regs. As a reminder, this goes into effect January 1 of next year. As Carrie said, however, we're now going to pivot and talk about Section 116 of the No Surprises Act, which is focused on provider directories. Next slide, please. Okay, so January 1, are you ready? A whole bunch of requirements kick in. First, if you are a plan, you are going to have a process in place for verifying that the provider information in your directory is accurate. As part of that process, you'll have, as a climax action, potentially kicking providers out of your network if they are just completely unable or unwilling to participate in the verification process. Obviously, neither you as the plan nor the provider as the participant in the plan want that to happen. This creates an opportunity, frankly, or more than an opportunity, but a mandate for plans and providers to develop good processes for keeping provider information accurate in directories. We know from a variety of studies and sources that directory accuracy right now is a real problem. Additional requirements. That directory needs to be in a public-facing provider database, and it needs to be updated not less than every 90 days. When a plan receives an update from a provider, the plan has 2 days to make the update into the directory. I know for many of you that's problematic, and we can later in the conversation talk about why that may be problematic and what we might be able to do about it. And lastly, and very importantly, if you do get questions from your plan members, from consumers about the directory, you have to respond in a business day with accurate information. So I'm going to be available throughout the rest of the webinar for Q&A. I'm going to turn things over to John right now. John.
Great, thank you. And April, you can stay on that slide. I have one comment for all the payers out there. we're hearing things like it's going to be impossible for me to meet the 2-day requirement depending upon what the change is. And a perfect example where you get notified that a provider has a different specialty that may, entail a recredentialing or a credentialing process. And our guidance to you, and I'd like Mike's reaction here as a former CMS regulator, is that make sure that you have a process and procedure in place that basically outlines your plan. And I think if you're on that ground, you're going to be in a good place because you can say, look, I can't change this piece of information in 2 business days, but what I've done is I've removed them from view in the directory until I can confirm that that information is accurate. So Mike, just like to get your reaction to that guidance.
Yeah, so John, if assuming there's no regulation that clarifies this problematic piece of the legislation as drafted, I think your advice is terrific and appropriate. I'm hoping that HHS will look at this when regulations are issued, and perhaps the 2 business day requirement will be qualified to certain types of information, but maybe other types of information could be carved out and subject to a clear process as you lay it out.
Okay, great. Okay, next slide. So now let's start to dig in and understand what are the responsibilities from both the payer side and the provider side, because this act really has set new expectations for the shared responsibility between both the payer and the provider. And the entire goal here is how do we get more accurate directory information, and how do we provide better protections to our members and our patients? We'll start on the payer side, and Mike had talked about this a little bit, is the payers are required to display and update the provider directory. They have to respond to those member requeries and information requests. And as Mike talked about, they have to define a process to verify the provider directory information. And the important aspect, if you didn't catch it when Mike said it, is they have to remove those providers who are non-responders. And so essentially, this is a big part of the Surprises Act, is for the first time that if providers aren't verifying their information, the health plan, by the terms of the regulation, is going to be forced to remove them from visibility to the consumer. So the other thing, and again, kind of re-emphasizing what Mike talked about, is this also gets into defining a process to verify the information on an ongoing basis. As we wait for clarity on the regulations, we'll get an understanding of, at what vintage do I need to remove a provider? Is that 90 days? Is that 6 months? As it stands today, it's basically you have to verify a process and create a process to remove those providers. So now let's change gears and go on the other side of the page and talk about the provider responsibility. So basically, providers now are required under the regulation to submit new and changed information to the health plan. And also they're required to notify a patient 72 hours in advance if they are an out-of-network provider, and give that patient the opportunity to consent to receive those services. Also, from a liability burden perspective, the provider is no longer responsible for plans who fail to update that directory information. So if I've notified my health plan that I'm no longer practicing in their network and they fail to update that, I'm not on the hook for those fees. And then also from a plan or provider perspective, they're no longer allowable to hold patients responsible for those out-of-network fees. So we really think there's a great opportunity for the payers to begin a campaign in educating the providers on why this is important to them. I need you to verify your information. I need you to do it 4 times a year. And if you don't do it, I'm going to have some consequences where I have to remove you from visibility within my consumer-facing directories. Next slide. So now we're going to spend some time talking about the implications and what does this really mean in the marketplace. You kind of get our title here, you know, the No Surprise Act. Are you surprised? Quest Analytics isn't. We've actually been following this for the last 2 years, and we've been setting up our tools to allow our customers to really understand the implications of what does the No Surprise Act really mean to them. So think about that. All of you are trying to put together your strategy. As I get into the next slide, I'm going to talk to you about what we've done to prepare the market for this moment. So Mike, what we did essentially is we said, what if we could predict what your network looks like if you did nothing? So I'm not going to verify my information. I'm going to wait until January before I address this. And the results are stunning. I want to share with you, this is a real live example of we took a health plans network, we boiled it down to just primary care only, and we focused on a single county in New York. And we said, okay, we're going to go from left to right on this chart. Access to care for my members today for primary care is 4.2 miles. If I took out providers who haven't verified their information in the last year. Now, again, I went back a year to kind of show the, you know, the severity of this is access to care changes to 34.4 miles. So Mike, question for you to put you on the spot. What do you think those members are going to do? Are they going to accept traveling 8 times more for an appointment?
Yeah, John, needless to say, this would shock the system. It would shock for members. It will be a shock. For providers, it will be a shock, and for the regulators and policymakers, it would be a shock. Needless to say, there is then a mandate for plans and providers and the experts like yourself to figure out a way that we can prevent this from happening. We don't have a ton of time here, but we have some time here. But this would be a public policy disaster and a member service disaster.
Great, thanks. It is really, like I said, I mean, think of yourself as a patient. Are you going to inconvenience yourself to travel 8 times further to see a doctor, or are you just going to go out of network? You know, odds are more likely that you're going to see somebody more convenient to you. The other thing, again, kind of the other wow, is the availability of PCPs in this real life example went from 157 options to 14. So again, to kind of emphasize what Mike said, this has the potential to, you know, to cripple the system. So now I only have 14 providers that my entire membership can see for this county. So the availability for somebody to get an appointment and the capacity of these providers are really going to be taxed. So what's going to happen? You're going to have increased consumer complaints. Downstream implications is that's going to have a ding on your CAHPS rating, which ultimately has a high implication on your star rating. So all of these things are really going to reflect negatively should a plan choose to do nothing. And then the third aspect that we're able to help identify is what does this change from a market percentage? On the far right, we're looking and says today, this particular health plan has about 13% of the primary care providers in their network. Well, think about a post-surprise billing. Now they have 1%. So what's the likelihood of a new member who's shopping for a health plan to find their PCP when they come to this health plan? So they're going to look, they're going to say, I can't find my PCP, so I'm going to go to health plan B to see if my PCP's in their network. So this is, again, kind of what we've done and what we can provide to all of our health plan clients is this lens so you can understand, where do I need to focus my efforts? How big of an issue is this going to be for me? And I better make sure I don't wait until January to make a decision. I need to make a decision by June, so I've got enough runway to put this into play. Next slide. But as April said, we've been in this marketplace right alongside all of our health plan customers for a long time. We understand this stuff is really challenging to get this information updated. It's difficult for me to attain updates from the providers. That's why I talked about earlier. It's really important that this becomes part of your communication strategy to educate the providers, because I guarantee, just like many of you on this call, many of the providers don't understand the implications of surprise billing. It's up to us collectively to educate them and make them understand why they need to verify their information, so that these aren't the downstream implications that happen that I described on the last screen. We understand the challenges with multiple compliance requirements. If you've worked with one state, you've worked with one state. It's essentially what we're providing guidance to our clients on. If the one state has a more rigorous regulation than another, well, just apply the rigorous regulation or against all of your states, so you have a consistent process. We understand that it's difficult identifying what's right, what's wrong, and what's missing in the data. And that's why, again, we're here to help you and show you how we can navigate you in this, this no surprise initiative. Other things that we see across the marketplace is that I have data in so many different places that it's hard for me to update that information. So again, when we help you identify what's wrong, what's right, and what's missing, we're going to work with you to make sure that that information gets updated in one location and then flows through all the other locations. And then the other things that we find from challenges is that many of our plans have an understanding that their networks really get inflated because of the way that data flows into their system. If you work with a health system, many of the health systems are going to say that every provider is practicing at every location to facilitate an automated claims adjudication. Well, we all know that when it comes to directory accuracy, that's not the reality, that typically that provider is practicing at 3 or 5 locations. And then, as I talked about earlier, this all kind of falls down to consumer protections and member satisfaction. And the longer it takes for you to get your arms around this, the bigger issues you're going to have around member dissatisfaction within your plan. So, Mike, I think you're going to talk a little bit about how this impacts the community and health systems.
Yeah, just make sure my mic was turned back on. Okay, so yeah, there are a lot of provider impacts here. And, you know, we focused a lot on this from the health plan side, but on the provider side, for those providers who have not yet really focused on the importance of keeping their health plan business partners updated, there are responsibilities on you. There are responsibilities if you are a facility and you do have health plan members coming in, to understanding their coverage and understanding if you have, again, multiple radiologists, multiple anesthesiologists, which ones take which insurance. And I'm very sympathetic to providers in this context because there is a maze of plans, and you can do business with one health insurer and have several different plans. And yes, they all have separate ID numbers, and ultimately you're going to have to figure out who does business with which one. That's complicated. It's also going to be required that you figure it out, and that you also figure out a way to deliver these good faith estimates. And there's a further provision in the law that if you deliver a good faith estimate and a plan member accepts that good faith estimate, and then your ultimate bill to the member is different than that good faith estimate, and the member is aggrieved, now there's going to be a process set up for hearing the difference and resolving the difference. So the best case scenario here is to get this right and to minimize the circumstances where you even have to contemplate delivering a good faith estimate. Again, minimize those opportunities. And as John said, ultimately, this is about protecting the consumer. And ultimately, it's about creating a more seamless opportunity between plans and providers to work together on something that's important and now part of the law. Next slide, please.
We thought this might be a good time to take just a few minutes and get a poll from our audience. I'm going to go ahead and launch that off right now. Just as we go into garnering some of these best practices and strategies from John and Mike, we thought we want to level set and see where you all are at in your planning stages. So the first question up there right now is, how are you starting to plan for new systems or processes in preparation for the No Surprises Act? So I'm going to give everyone just a second or two to go up there and answer that question. Mike, John, you can see, well, you probably can't see right now what's coming in. So we're going to give people just another second here. And the second question that they're answering is, when are you starting to plan for the new systems or processes needed for the new No Surprises Act? So really seeing if, have you thought about it? And if you have thought about it, what have you already done about it? So kind of level setting going into those strategies for you, John, so you kind of know right where everyone's head is at and just how much of a surprise this really was. So I'm going to go ahead and end the polling now, and I'm going to go ahead and share the results with you. So just real quick, John, as you're heading into this, as we're talking about how they're starting to plan with the new systems and processes in place, it looks like 53% say they're just now digesting the news. So it is kind of a surprise, it appears. And then the second question here, when are you starting to plan for the new systems or processes needed for the No Surprises Act? It looks like the majority of them are starting to plan for it right now. So this webinar is very timely for all of you, because John's going to walk you through what you should be doing now and what we've been hearing from our plans partners and just some all around great strategies and best practices. So I'm going to stop sharing these results and close out of our poll, John, and then I'm going to pop you over right here to best practice and strategies, and I'll move you right along.
All right, sounds great. Well, I'm really pleased to see that the majority of the folks are really looking at this, and I think only a couple of folks said, hey, we're going to wait and see. I'd encourage everyone that, you know, this isn't a wait and see type of opportunity or option because of the dramatic impact that it potentially could have on your competitiveness of your network come January of 2022. So I thought I'd share a little bit about what some of the leading plans that we're working with are doing, as April had said, kind of talking about best practice. You know, I had shared earlier that, you know, we know that these networks churn pretty frequently and information gets stale and outdated. So how do I manage that? And we've come up with really kind of 3 key aspects that we'd recommend that you digest and consider as part of your strategy. And we refer to that as promote, demote, and fix and note. And when I say promote, basically we know information about a certain population of our provider network to be correct. And that's a great thing. So we want to take that information, and when a consumer comes to our directory and searches for a provider, the providers who verified their information automatically get promoted to the top. So think about the benefits of that. Is number one, you're going to have a happy member because they're seeing a provider who's in the network. And also you're going to have a happy regulator, because when the regulator comes to audit you, they're going to basically go to your online directory and they're going to search for a cardiologist within 10 miles. And then they're going to pick up the phone and they're going to call the ones on the first page. If all of those providers on the first page are the ones that you've actually verified his or her information, you're going to be in a good spot from a compliance standpoint. The second aspect is actually just the opposite. There's going to be a percentage of your provider network population where they are non-responders. They haven't responded and verified his information. So just like you've promoted the ones who verified, you want to demote the group of providers who haven't verified their information to do two things. Is one, protect the consumer, because the consumer is not going to go to page 20 of your online directory to find that allergist. They're going to find one on page 1 or 2 that's within 5 miles of them. So you're going to demote those providers that you don't know and they haven't verified their information. And then the last aspect that we're hearing in the market from, again, our clients is, I'm going to fix that information that I know to be inaccurate. I'm going to fix all those addresses that I have a provider listed at 80 locations because I know that isn't realistic and it puts me at risk. I'm going to remove providers who've retired from practice and make sure that I don't have those providers visible to any of my consumers in the marketplace. So it's a really simple strategy and it's a really powerful strategy because it provides the consumer protections, the consumer satisfaction, and it protects you from a regulatory standpoint when you're going to get audited, because that's the vehicle that they're going to use to perform the audit, because that's what they're going to confirm. Are you protecting the consumer and how are you addressing the problem? Mike, anything to add there?
No, John, I think that's right on target. If you're a plan, this is going to become really important. Obviously, there are other things that make certain providers important. So conceivably, you might want to balance this with other plan priorities as well, such as outstanding performance on HEDIS or whatever else. But it's going to be real important that you get the attention, if you are a plan, of your network providers to verify. This is certainly a way to do it.
Okay, next. So I was really pleased on the results to see so many of you have work groups together. So many of you, this is a surprise, this is brand new, but as your long-term partner, we put together a series of questions. And actually at the end, I'm going to show you, we put together a whole website that is designed on helping you get ready for the No Surprises Act. So these are some of the things that you should be doing internally. And again, you'll all have access to this presentation, but basically identifying, what are you doing today to verify your information? We've had some people say, hey, John, I plan on using claims data to verify that information. Would caution you, what you're going to find is when you dig into that, you're going to find that 20% of the providers are seeing 80% of the members. So you can't solve it by doing that. You really need to understand, how do I leverage updates across all lines of business? I have a commercial network, I have a Medicaid network, a Medicare network, an exchange network, and to make sure that information is consistently updated across all of the lines of business. Another important aspect that we think is really going to be critical for you in the market is knowing the age that your data was verified. Now think about how you can leverage this. Is number one, you're going to have to create, as Mike said, a process to remove providers who haven't verified their data within some time frame. Well, if you're not tracking when the last time that information was verified, you're going to have no ability to remove. If you come down and say, hey, I want to remove everyone who haven't verified in the last 6 months or the last year, you're going to have access to that information. But I'm going to tell you another valuable asset of having that information is you can make it consumer facing. So now when I go to your online directory, I can see Dr. Smith, And I can see Dr. Smith updated her information on February 20th. So again, it provides the consumer with comfort to say, now I know when this provider last information was verified, and I have a better experience with the plan. Also, I believe it would look really great to regulators. Instead of having my directory was last updated on March 21st stamped on the search site, now every individual provider has a last updated date for that particular record. The other thing that is essential, and I talked about this earlier, with a process and procedure, you need to have a means to measure, manage, and monitor the accuracy of your data. And you need to have a process to measure it over time. The importance of measuring and trending this information is because, again, I spoke earlier, when you get audited, and it's not if, it's when, to show that you have a process in place and you've been trending and monitoring this over time is an essential part of that audit that's going to help you really look good on that. So what we've done in preparation for this is we've expanded the Quest Enterprise service. So now it not only looks at the adequacy of your network, but it looks at the accuracy, and it answers those questions. Are you improving over time? And then where do you need to focus your efforts? Do you have providers at multiple addresses? Do you have deceased providers? Do you have retired providers? Do you have providers that have multiple specialties that are not aligned? So again, kind of, get back to the question of those of you who are surprised. It's a good thing we've been taking the last 2 years and preparing our tools so we can not only look at the adequacy of the network, but can look at the accuracy of your provider directory as well.
Yeah, John, I'll just come in here for a second, if you don't mind. To your point about demonstrating that you have a credible practice in place and improvement over time, it's probably fair to say that things are going to be kind of messy for a lot of people on January 1. And if a complaint comes in and if a regulator takes a look, to be able to demonstrate that you're on top of things, and maybe it's not perfect, but look how much better it is than 6 months ago, and look at the process we have in place to drive continuous improvement. That's going to really help with regulatory inquiries.
So we're going to close up here before we get into Q&A and just talk a little bit about, what's the time frame? Again, about 50% of you, this is brand new. Don't worry, you still have time to put this in place. Today's a great place to start, and we're going to walk through again kind of the phases that you really should be thinking about as you walk down this path. Awareness, as I said, use this webinar to help your team understand, what we need to do and how you're going to do it. Put into play, your planning and understand, get that risk assessment that I had, that illustration that I showed, that access to care went from 4 miles to 34 miles. Provider selection went from 157 to 14. You can work with us as your partner to essentially give you an assessment of how big of an issue is this really going to be for you, because I'd rather know the depth of my problem on April 1st than waiting until October and then trying to put together an action plan. Which kind of leads us into phase 3 is once you understand the depth of this, now you got to basically select your business partner, and that selection really should happen no later than June, because as I illustrated from that live example, is this could be a very daunting task, especially for you plans out there who are national in scope. It's going to take you 6 months to get your arms around this thing and make sure, as Mike had articulated, that at least you have a plan of attack. You may not have solved the issue by January 1st of 2022, but you've got an attack plan and you're on your way to solving that. And then finally, it's execution. and you're going to learn things as you go through the process. I talked earlier about the whole premise of today's the day to start communicating to your provider community the importance of this and why you need them as a partner to help you solve this issue. Today's the day where you start to say, by this date, I'm going to take this action, and I'm going to start doing some of the things that I learned about at this session. Again, we talked about the promote and demote it. You don't need anyone else but your internal resources to say, if I know something is right, well, why don't I start to promote it and make sure that I'm starting to protect my consumers and I'm protecting myself from the regulators. And as I said, we've created a whole website. So if you go to nobodylikessurprises.com, we've got a wealth of resources out there for you. Again, some of the questions that I talked about are out there, more information that you can download and get access to this. And this is just the first. This webinar that we're doing today, we plan to do these ongoing to really help you understand what your peers are doing in the industry. Just like the promote, demote, fix, and note. We'll be able to give you information on, why using a claim-based approach isn't a solution to the problem, actually could worsen the problem. Because we'll get into things once the more rulings and the official regs come out of what does this really mean if you're forced to remove providers who haven't verified their information in 90 days? Can you keep somebody in the directory if they haven't verified in the last year? So we look forward to coming back continuously as your partner to continue to help you understand what this means in June, in July, in September, et cetera, as we get closer to that deadline. So in kind of closing, I'll walk away kind of the key takeaways that we'd like you to digest here is, the No Surprises Act, this finally brings the commercial plans into the regulatory fold, right along with what we've had to do on Medicare Advantage and Medicaid. As we've talked about many times during this session, you've got to have a verification process and a removal process in place to protect those consumers in a very short window here by January 1st. And then also you need to make sure that you're prepared to measure and monitor that network from adequacy and accuracy so you can see how you're trending. So I can see that, hey, on June 1st, I really had a significant gap, but by October, now I'm trending in the right direction. So I'm feeling really good about my progress over time, as opposed to just shaking the dice and seeing what's going to happen on 1/1 when this regulation goes into effect.
That's great, John and Mike. Thank you both so much. Now, we've had a ton of questions coming in through the Q&A panel. There's a lot of people surprised by this and want some clarification on a few things. And I know the two of you are just the perfect pair to answer these questions for them. I know we kind of just covered one of these on our key takeaways slide, but one of the things that keeps coming up in the questions is, does this only apply to commercial plans?
This law is for commercial plans, which would include fully insured and self-insured, and it would also include, for example, ACA exchange plans.
Yeah, think about the one thing we didn't cover, Mike, that I think is really interesting. I'm glad somebody brought up the commercial plans, is think about what this is going to do for the self-funded employer selection process on things like disruption of, if I'm forced to remove all these providers from my network, what is access to care going to look like? But what is disruption of, me selecting and having to go to a new provider if I change a plan? So I really think it's really going to have an impact on the benefits consulting community, the TPAs, as well as the self-funded employers as well.
So funny you should mention TPAs. One of the questions was that they knew it was self-funded plans, but when a TPA and a provider network involved, does this regulation apply to both?
Do you want me to take that, John, or do you want to?
Absolutely, sure.
So, without being the world's greatest expert on this part of the law, the legally liable entity is the employer. The employer is going to have delegated entities who are working for the employer, including the TPA, and if the network's contracted separately, then the network. So based upon the flow down provisions that will likely be in the contract, then the TPA and or the network may be responsible as well.
All right, so I'm going to throw another one at you. So we talked about the provider impact, right? And so there was a lot of talk around, John, you mentioned how some of our plans have mentioned that 2-day requirement. What does it exactly mean? Someone thought you were going to elaborate a little bit more on that. And then also there's some questions around what do you do with the providers that aren't responding? In particular, one statement I think everyone's kind of thinking it is kick the provider out of the network or remove them from the directory if they do not respond. Is that an option? What are the options? There's a lot of conversation around this particular aspect of the regulation.
Yeah, I mean, we'll definitely have more clarity, April, when the final guidelines come out, targeted by June. At this point, what we're telling people is, look, if I were the health plan, I wouldn't terminate the contract. I would basically, suppress the provider. Let's say if I was needed to meet a 2-day rule, I'd suppress the provider from directory publication until such time that I reviewed the information. And then I document that this is my process. So I've done something within 2 days, I've suppressed him, and then I can put it into my workflow and actually complete that action and verify, and then promote that provider once I've verified their information. So that's the approach I take is again, because I should be able to suppress any provider within 2 business days. I just can't confirm that if their specialty change, there's no way that I can credential them in 2 days because my credentialing committee only meets once every 60 days.
Did you have something to add to that, Mike?
The only thing I'd add to that is particularly in more rural markets where the networks may be thinner, you need these network providers. So John's points are all spot on, but pick up the phone and do some friendly outreach and see what you can do about getting your providers to understand the need here prior to a suppression scenario. And if your credentialing committee only meets every 60 days, you might need to revisit that as well.
All very good points. I know we're talking about the No Surprises Act, but that obviously has some overlap with some other regulations. So one of the questions that came up was, how do you see this rule interfacing with the interoperability rules and the provider directory API requirement? If I recall correctly, that rule requires updating within 30 days of receiving an update.
John, do you want to take that or should I?
Well, I'll start with it, Mike, and you can add. I think again, I know we keep kind of punting back to the, to the final guidelines, but I think a lot of this is going to come into play, and I would think all of these things are going to wrap up into more consistent measures, which I think is great for the payers in the marketplace. Things like interoperability, having access to that data and the timeliness of it. I think they'll all come down into a single standard that plans will have to adhere to.
Yeah, there was a term that was popular during the Obama administration called harmonization, which is whether you're a provider or a plan, if you're doing business across multiple markets, why are these various requirements not harmonized? And so there was an attempt, for example, with appeals and grievances to get to harmonize the rules across markets to allow plans and providers to increase the efficiency of the process. I imagine that we'll see a renewed interest in harmonization in the next couple of years, but whether that harmonization will be in place on January 1st or not, I'm doubtful.
Another question, and I don't know if we know the answer to this yet, but maybe we do, is verification every 90 days. Has it been defined, is that quarterly or literally every 90 days?
The simple answer is I'm stumped. I'd have to go back and look at the statutory language. I don't know off the top of my head.
Not a problem. We can circle back on that post-webinar as well. One of the other questions on here is, how do we handle physician abrasion? Obviously, this is a pretty relevant topic when there are multiple firms, vendors, agencies reaching out to provider offices on behalf of health plans. John, do you want to take that one?
Absolutely. It's a great question. It's again, I kind of go back to my point of, why we weren't surprised and why we've been preparing the last few years. As many of you know, in 2018, we actually acquired an asset called Better Doctor. And that solution essentially allows us to reach out to the provider once and then share that information across the 400 plus health plans that we work with to really hit on exactly what the question was about provider abrasion. What we found out is that a typical provider will practice between 10 and 12 different health plans. And we understand now that this new ruling on the commercial side, they were getting hit on the Medicare side and the Medicaid side. Now they're going to get hit on the commercial side. So essentially, that's why we put that plan in place, over 2 years ago. And essentially, we've solved the issue on a large portion of those providers in the marketplace today.
So Mike, it's only fair if I give John a question, I'm going to throw one right back at you. So what is the chance of this law being changed or rescinded by the new administration, especially since it was passed back in December? Any thoughts on that?
Yeah, we're not, this isn't being rescinded. This is, the No Surprises Act was bipartisan. The Consolidated Appropriations Act, which the No Surprises Act was passed as part of, was bipartisan. Democrats tend to like consumer protection-y kinds of things like this. It's not going anywhere.
All right. So when we talk about outsourcing the credentialing of providers and the network credential, they send the profile sheets to the plan to load. So they add and modify the term of the providers. They're their source of truth, if you will. I guess the question is, in that kind of situation, any thoughts on who would be responsible for the verification, or is that just not clearly defined yet? John?
Yeah, I don't believe that it's clearly defined. And I think there's two different aspects here. There's credentialing data, which is, state license information, malpractice, that type of data, is coming from the entity that is providing it. And then there's sources out there to confirm if that information is actually legit, whether it's, state licensing databases that you verify that information, malpractice databases that you verify the information. The No Surprises Act really focuses on some of the other data. Is Dr. Bean in health plan A or health plan B? And that information really you need to get from the provider. And so it's two different data points, and I think both are valuable, but I think the No Surprises Act really focuses on the information that you need to get directly from the provider themselves.
Perfect. All right. Another question, and Mike, this might be a good one for you. Are we aware if the directory requirements only apply to group health plans, or do they also apply to work comp plans?
I would need to check. I don't know off the top of my head.
And that's okay. We can check back on that. And so we'll circle back on that, Sean, and get you an answer to that. All right, let's see what else we have. In a production environment, we might not get to the update request within 2 days. How do we handle such situations? And any advice on that?
I think, again, I'll kind of fall back to what I had talked about earlier. I think it's making sure that you document your process on, what prevents you from getting that 2 day. Like I said, I mean, it may be, the workflow needs to be changed, but I think, making sure that you have a process documented that you're following, and that you get your compliance officer involved and make sure that, he or she is signed off on it. I think that's really, an area that you make sure that the compliance people are part of your work groups, so that, they're, you're walking hand in step together to make sure that, the path that you're heading down is a path that he or she is going to be comfortable with as well.
John,
Yeah.
Oh, go ahead, Mike. I'm sorry.
I was just going to say there may be a time at which you hear from your regulator what the regulator's expectations are, whether specific expectations. If you're not meeting your regulator's specific expectations, John's advice is great. At some point, you may also want to consider self-disclosing.
Great. Well, like I said, we got through the majority of the questions. We're right here at the top of the hour. I know everyone has to get going. Thank you both for joining us, Mike and John. Just a plethora of really good information. We will be sending out a copy of this recording to everyone in attendance. So I know that question came up quite a bit. Once again, thank you both. I also wanted to let everyone on the call know that our annual industry conference called Vision Quest 2021, that we're hoping to be live in person at the Hutton Hotel in Nashville, but fingers crossed on that one. October 26th through the 28th, we have opened early bird registration as of this minute. So you are the first ones to find out that website is now available and registration is now open. So you can go to visionquest.questanalytics.com and find out some preliminary details about the conference and get registered. So again, thank you all for submitting your questions. They were a lot of them, and I hope we got to most of them. I think we did. Feel free to reach out to us if you have additional questions. Visit the No Surprises website. You can also get to that at questanalytics.com. Surprise billing, just in case, because I heard that there were some people having trouble getting access to the website. So we'll be sending out that website URL and this recording post-webinar. Thank you all for joining and have a lovely rest of your day.